The IPO calendar has heated up once again, and we have a couple of medical names coming up on the calendar. Tetraphase is the first one we're going to talk about. Now, Francis's company focuses on antibiotics for these diseases that are becoming very resistant to antibiotics, and we know this is a huge problem. Is Tetraphase going to have the answer?
Well, it might. On the IPO, it's going to be funded, excuse me, the stage 3 clinical trials for their lead product. And if they have a successful IPO, that'll be funded through 2015. They lost $15 million last year, so they got about $7 million in grant revenue. So I think this is one probably to pass on the IPO because of the loss rate, because the clinical trial won't be finished until 2015. But it's definitely something to watch. This is the kind of company that may be an opportunity in a secondary down the road as they make more progress.
All right, then we also have Enanta. Now, this company is hoping to raise $60 million, but the key thing about them is that they have some pretty big partners. They're partnered up with Abbott Labs and Novartis, so that's usually a good sign for a company, right?
Yes, this is a really interesting biopharma. I've never really seen a company that went into an IPO with a really good cash position, and after the IPO, they'll have about $107 million in cash, which will be 42% of the market cap. I mean, I've never seen that before. So I'd say the management's really a 5-star management. They have the collaborations going, that they have an independent product that they're developing themselves, and they're not, right now, so far, they're not bleeding cash. So it's also coming at 2.1 times book value, which is low for these kind of biopharmas. I don't quite understand the metrics, but I think that one will do very well on the IPO.
All right, and as we know, last year, the medical offerings all actually ended up having pretty good performance, even though many of them priced lower and got off to a slow start, but they ended up having good years. Maybe that will repeat that trend again this year. So when we take a look at these, Francis is suggesting that you might be more kind with Enanta and Tetraphase. You might want to take a pause on that one.